Good evening. If you are here for the Hands Off Our Healthcare Power Hour, you're in the right place. We're giving folks a couple of minutes to get on, and we will be getting started shortly. We ask that folks announce themselves in the chat, who you are and where you're from, and any organization you're representing. It looks like the chat is disabled. We will get that fixed. Wonderful. Good evening. If you are here for tonight's Power Hour, you are in the right place. Please announce yourselves in the chat in terms of what organization you're representing. I already see NCNW. I see NAN. I see Delta Sigma Theta. Welcome, welcome. You are in the right place. Good evening, family. It is good to be gathered together this evening for tonight's Power Hour entitled Hands Off Our Healthcare. And we literally mean that, hands off our healthcare. As you continue to join and announce yourself in the chat, we're going to get started because we want to make sure we're being good stewards of everyone's time. My name is Jamal Watkins, and I proudly serve as the Senior Vice President of Strategy and Advancement here at the NAACP. And I am joined with colleagues, friends, and leaders who are here to set the record straight and lift up exactly what we're facing come this week as it relates to the COVID-19 public health expiration. As you all know, for the last 3 years, the federal government, primarily through the Secretary of the Department of Health and Human Services, had declared both national and public health emergencies with the goal of increasing access to services, including testing, vaccinations, direct payments, insurance coverage, etc. And with each declaration, it had its own unique requirements and expiration among them. And so in this moment, we know that on May 11th, that is this week, the public health emergency will actually come to an end. Also, the national emergency declaration, which was issued in March of 2020, will also come to an end on that same date. Now, I'm not going to belabor you with all of the facts and the nuances. That's why we have an amazing lineup of leaders and speakers here with you, including the first Black woman to lead CMS. But I'm actually going to turn the floor over to our fearless leader at the National Association for the Advancement of Colored People. He goes by the name of Derek Johnson. He is our president and CEO. He hails from the great state of Mississippi. And without further ado, none other than President and CEO of the NAACP, Mr. Derek Johnson.
Thank you, Jamal. And I want to thank the chair and vice chair of the Health Committee for ensuring that we pull this important conversation together. Just over 60 years ago, there was a group of medical doctors. They were operating under the banner of Medical Doctors for Civil Rights. They began to raise the questions around inequities as it relates to access to health care across the rural South, but particularly in Mississippi, where I currently reside. In that same organizing spirit, there was a lawyer, the only female Black lawyer who was a part of the group in Mississippi, also organized it, by the name of Marion Wright Edelman. And out of that experience, she created the Children Defense Fund, also recognizing the public health crisis young people were confronted with. Here we are some 60 years later, still dealing with some of the most critical access to health questions across the country, with 9 states who have refused to expand the Affordable Care Act. It is, in fact, a civil rights issue. It is an issue that NAACP takes seriously. It's an issue that we are bringing forward individuals to provide leadership expertise on how we navigate this current political space. So I hope you put your seatbelts on, take in all the information, because NAACP, we're an advocacy group, and access to healthcare is something that we must advocate to ensure not only equal protection under the law when it comes to healthcare, but equal access for health outcomes that would impact a better quality of life for all of our citizens in our community and those we represent. So thank you, and I am standing by to listen to this wonderful information that we're about to receive.
Hello, everyone. I am here today representing the Youth and College Division of the NAACP, and my name is Camille Trotman, and I'm the chartering president of the Georgia Tech unit of the NAACP. And I am currently a rising senior at the Georgia Institute of Technology in Atlanta, Georgia. And I served as the Georgia Democracy Fellow last year, and I am a member of the Delta Sigma Theta Sorority Incorporated, and I am the vice president of the Xi Alpha chapter at Georgia Tech. But today I will be first introducing Dr. Dwayne Proctor, the chair of the NAACP's National Health Committee. During his 20 years of philanthropy, Dr. Dwayne has always worked to ensure that America's communities were healthy and thriving. Before becoming president and CEO of the Missouri Foundation of Health in 2021, he served in a variety of roles at the Robert Wood Johnson Foundation. And today he has done lots in our community. And right now he is serving as the chairman of the board of trustees at the NAACP Foundation, and he is the former chairman of the board of directors for the Association of Black Foundation Executives. And I'm so excited to see what he has to say today.
No, thank you, Camille. Always a pleasure to work with you and others in the Youth and College Division. We always know that an intergenerational approach to our work is what's going to lead us to a success as a people. And I'm glad that we're here with you today and with so many others. On behalf of the Health Committee of the NAACP and the National Board of Directors, I want to welcome everyone to this Power Hour that we're having. And I want to thank you for this participation. I want to thank the panelists. I want to thank all of our guests and the hundreds of leaders who have all showed up for this call. We have an opportunity here to acknowledge a basic fact, and that is that the struggle to have access to quality, affordable health care continues. It is not over. It is not a done deal. Each of our states are approaching this differently. Each of our communities are affected differently, and it's our diversity that's on this call today representing the communities we care about and people we care about that's going to give us strength in this moment. Here in Missouri, the struggle for Medicaid expansion continues. You may have read in the paper that by referendum that the people have voted to have Medicaid expansion as part of a constitutional amendment. You may have heard that our legislators denied that request of the people. You may have heard that our governor also supported that denial of the request of the people. And you may have heard that litigation needed to be brought forward that has resulted in, over the last 2 years, 280,000 people now having access to the health care they need. And here in Missouri, we also know that those gains, that struggle that has been ahead, it's not over. There are always opposition and forces looking for different ways to peel this back, to make the access to healthcare not as accessible on some things as well as on other things. And we know that in each of our states, we're going to have to approach this differently. One of the advantages we have is this Power Hour, this opportunity to get clear information, straight information that all of us can use in a variety of capacities that we come here today. So whether you're here as a D9 representative or civil rights groups or faith-based organizations or community groups who are interested in this information, this is a unique opportunity for us to hear information and be on the same page. Our unity in that way is our strength. Our ability to embrace what we learned tonight is our strength. And our panelists, to honor their participation, we need to put what they have to say to work for us. So without further ado, I want to thank everyone for being here tonight. I will also be here for the entire time of this presentation. Thank you all so very much.
Next, I'll be introducing Siobhan Arline Bradley. She is the president and CEO of the National Council of Negro Women and the vice chair of the Health Committee at the NAACP. So Ms. Arline Bradley, who is also an ordained minister, brings 21 years of experience in healthcare, equity, diversity, and inclusion, government affairs, and executive leadership. She is the founding principal and CEO of REACH Beyond Solutions, a public health advocacy and executive leadership firm promoting EDI, political and organizational strategies, risk management, government affairs, and technical assistance. In January of 2023, she was elected as the first president and CEO of the NCNW in its 88 years history. And today she'll be speaking to us.
Well, thank you, Sora, and thank you to all of the listeners. Jamal, we have over 850 listeners. We are excited to see the kind of support we're getting tonight. I am looking in the chat and ecstatic. I see members of NCNW. I see some of my board members that are here. Our sister Greeks are representing top ladies, Black nurses, National Medical Association. I'm a proud member of Delta Sigma Theta. I see my AKA sisters, my Zeta sisters. It's crazy in the chat. So we are excited about this kind of connection. And the reason why NCNW is at the table, I do want to thank my colleague and friend, Derek Johnson, who is the president of the NAACP. As you all know, my background, I was a proud staff member of the NAACP a few years back and served as the health director. And this is a near and dear place of my heart. And one of the things that's most important about tonight's conversation is that you will hear from not only historical leaders, but you'll also hear about some of the key talking points that we want to share with you tonight. I do want to say in my capacity as the NCNW president and CEO, I am also a part of a legacy. There are 8 legacy civil rights organizations that are committed. I see the National Action Network is here. Some of our Urban League family is on the line. We have representation from the Black Women's Roundtable all on tonight because we have partnered and collaborated to address this issue. And I do want to say this very clearly. We have been in conversations with Madam Administrator. I love saying that. Shakita Brooks-LaShore is an amazing friend. I'm going to introduce in a second. But we're also ecstatic about someone who is in office who is looking out for the advancement of equity in healthcare. And as we're thinking about the work we did, when I was at the NAACP, as a matter of fact, it was 2010, when that bill was signed into law, where the Affordable Care Act was actually passed and codified by President Obama. And Dr. Proctor and I worked very hard on that, and that was 13 years ago. Well, 13 years later, we're having a different conversation, but it's connected. We're saying hands off of our healthcare because what we are finding is that African Americans at this point are at risk. We are at risk of losing access to healthcare because of a few glitches. And let me talk about some of those tonight. I am a proud member of the Council on Black Health. The Council on Black Health is a united organization that sits a Black organizational roundtable. The NAACP, NCNW, Delta Sigma Theta, 100 Black Men of America. We have the National Black Child Development Institute. We also have the Black Women's Health Imperative. We are united to force this issue of access to care. Now, I want to give you some highlights on this because one of the things that we've talked about, and I see Dr. Wick Glover is in the chat, who is joining us from the council. We've been talking a little bit about healthcare access. And one of the most important parts of this conversation tonight will be around what we've been calling Medicaid redetermination. You've been hearing that, redetermination. And I know many of you have been asking, what does that even mean? And tonight we're going to frame this conversation in a way that'll help you understand what it means to have what we call Medicaid renewals. One of the things that we're trying to do as legacy organizations is to get the word out that there must be opportunities in place for beneficiaries who may still be eligible for Medicaid or CHIP, but they may be losing their coverage because they are unaware of their eligibility. They may not have gotten their information. What we know is in the last 3 years, our community has been devastated by the pandemic. We know in the last 3 years that fathers, mothers, children have been in some instances displaced from their addresses. Each state has different rules about Medicaid. We're going to talk about that tonight. But one of the most important things for you to know is that you should check your role of your state. Are you eligible? You must have the right address so that your state can send you the appropriate paperwork so that you can find out, am I eligible or am I not? Eligibility is very important, but here's what's also important. If you're no longer eligible, how do we ensure that you have access to healthcare? We're going to talk about that tonight as well. As a health advocate, Dr. Proctor and I, we have worked tirelessly to ensure that African-American families understand what insurance they have access to. This is why the NAACP, this is why NCNW, we have all been at the table in conversations with CMS, Centers for Medicaid and Medicare Services. Let me make sure I give you the acronyms, because we want to ensure that our communities have the opportunity to assess their eligibility. We're also in conversations across this country with our advocates, because we're seeing issues like work requirements that are coming up. And work requirements are a challenge for us. There are proposals right now, even in Congress, that Medicaid recipients have a work requirement. And we understand that this is a concerted effort to really block access to the right to healthcare. And I said those words very clearly, the right to healthcare. As civil rights organizations, as the Divine Nine, as those of us that have been working together, we believe that healthcare should not be a privilege in this country. We believe that access to care is a right. It is a human right. And as the United States of America, the country with resources, the country that can provide access, we want to ensure that working families, and there's a lot of assumptions out there, but many families who are on Medicaid right now are working families. I want to say that again. They are working families who may make too much to be eligible for certain credits, but not enough to be able to afford their premiums. So Medicaid expansion has become a standing part of our rallying cry. My friends, my brothers and sisters in this chat, please understand, we are united across the table. We are united as civil rights leaders in this country to say, hands off of our healthcare. We will not stand to see children and mothers and fathers taken off the roll because of a glitch in the system, because their address changed, because they did not receive their flyer in the mail. I want to close with this. One of the most important things we're going to be talking about is what's been happening in our country. Now, if you watched a few months back, our President of the United States, President Biden, he talked specifically about some of the benefits that have been coming down the pipe, some of the cost savings, the prescription drug laws that are in place. As a community, we want you to hear it here first, and you'll hear more from Patrice and from Madam Administrator, that this administration has kept their promise. Now we're calling on the accountability of the industry, and we're calling on the accountability of advocates to say, now keep your promise, sustain these cuts, and ensure that we as a community have access to care and benefit from these drug cost caps that have been put in place. For those that may be suffering with issues like diabetes, chronic disease, there are certain medications right now that now have a prescription drug cap. And because of this administration, we applaud those efforts, but we're saying we still have more work to do. So that was just my comments and remarks about what we're thinking as a community. And I want you to be fired up about this. This issue is a civil rights issue. Access to healthcare is a civil rights issue. I remember even 13 years back, we would say, you may not like Obamacare, but you like the Affordable Care Act. That was our inside joke, that people really didn't even understand what they were saying. That the access to healthcare was in large part because of the first Black president's intentional plan to pass this law. Now, was it perfect? No, but we're here now in 2023 having the same conversation. And make no mistake, hands off of our healthcare is connected to voting rights. It's connected to reproductive rights. It's connected to all of the rights that we see as a part of our portfolio as a civil rights community. And you as advocates have the opportunity to engage us. So all 952 of us should be excited tonight because we are ready to see these hands come off of our healthcare. Now, without further ado, I am beyond honored to introduce someone who is a first. She just so happens to be from the great state of New Jersey. She just so happens to be an amazing Black woman. Chiquita Brooks-LaSure is the first African-American woman to serve as the administrator of the Center for Medicaid and Medicare Services. She is not only an advocate for healthcare, but she is an advocate for our people and all people. She stands really at the crossroads and intersection of connecting access to community. And I am so delighted to have her, not only as a partner in civil rights, but as a friend in this work. So my friends in the chat, let's hear it for the first ever Black woman administrator of CMS, Chiquita Brooks-LaSure. Please come to the microphone. Thank you so much for being here tonight.
Well, thank you so much, Siobhan, for such an incredible introduction. And I really want to say a huge thank you to everyone who is on this panel. I want to thank Jamal, Derek Johnson, Dr. Pryor, Camille, Patrice, just everyone for this conversation, because not only am I just thrilled and fired up by what everyone has said before me, but just so excited that we're having this conversation. And one of the things that I'm going to pick up from what Siobhan said is we are in such a different place than we were 13 years ago when so many of you helped us pass the Affordable Care Act. And the work, I remember I was on the floor of the House when we passed the legislation, and the work was just beginning. Years of implementation, and then years of so many of you working on the ground to convince your states to expand Medicaid. And so we are in a different place in many respects. There are now, just to tell you a little bit about CMS, we cover over 170 million people in this country. So between the 3 M's in CMS, as I like to say, Medicare, Medicaid and CHIP, and Marketplace or Affordable Care Act coverage, we now cover almost 1 in 2 Americans in this country. And it is incredible to be here at this time because I like to say that coverage is necessary, but not sufficient for us addressing health equity and inequities in our country. And so when we think about the Medicaid program and thinking about what it means really being able to address maternal health and infant health, because almost half of the births in this country are covered by the Medicaid and the CHIP programs. It means addressing diabetes. It means addressing some of these issues that are so core to what our people care about, what we need. I know that many of you may know this history, but it's deeply meaningful to me that Medicare and Medicaid are what desegregated hospitals in this country. And it shows you what money can do in terms of making change. And that's what it's important that people really understand, that CMS, in making its rules, in setting its standards, really can help change our healthcare system. And I just want to thank all of you for the work that you have done on the ground to give us the authority that we need, to give 4 states to do what they need to do, to encourage stakeholders. That work has been incredible. But as with everything, I think the vice president said this recently, every generation has to continue to fight for justice and continue to work. And right now it feels like every generation's every 5 years because there's just so much work to be done. And I think that over the last couple of years, we as a country got a big education in what happens when we have healthcare disparities. It affects not only the individuals that don't have access to the care they need, it affects their families, it affects all of us, certainly as we've gone through this pandemic. And I do think that we are at this critical inflection point where there is a new interest and a new focus on health equity. But as we all know, these things can be very fleeting. As Siobhan mentioned, we're already having a conversation about adding barriers to care. And Siobhan is so right. We have data to show that the vast majority of people on Medicaid are working. But what we know from history is that when we set up barriers, we catch not only the people that are subject to them, but we capture everyone. And that is why, in terms of making it harder, and that is why we at CMS are very, very focused on Medicaid unwinding and making sure that people across the country really understand what this means. And I'll just spend a few minutes talking about what we are trying to do as an agency in our approach. And then we'll again just thank you for all the work that you're doing and really say that the next 12 to 14 months are going to be crucial. So I'll just say that what the law says is that at the end of the public health emergency, states who have had to cover people continuously, so they have not been doing what we call eligibility checks, which is something states always do, but haven't been doing during COVID-19 because of obvious reasons. They haven't been doing that, but now that process is starting again. And for some states, this is new, like they've hired new staff and their staff have not done redeterminations. And for some people who are on Medicaid and CHIP, this is also going to be new for them. They haven't gone through this process. And that's one of the reasons why it's so critical. What we know about people who are on Medicaid and CHIP is their incomes fluctuate a lot, right? So you may have gotten a job, multiple jobs, you may have moved. So many things may have changed in your circumstances. And that's why states are going to be going through this process where they're going to look and see, has your income changed? Are you still eligible for Medicaid? Do you need to enroll in Medicaid in marketplace coverage? Do you need to move to your employer coverage? When we go through these kinds of processes, they can be really confusing. And some states are as motivated as possible to hold on to coverage, other states less so. We have outlined detailed rules and flexibilities that we're giving states, but there are going to be some decisions that are up to states. And so really encourage you to connect with with each individual state to understand what the timeline looks like in the process, and really encourage them to take advantage of the flexibilities that we have outlined in our guidance. The most important thing for everyone on this call to know is to make sure that you, your constituents, everyone in our country knows that they need to update their information as their states are reaching them. So this is going to happen over a 12-month, 14-month period where states are going to be reaching out to people and say, give us your information so we can look to see whether you need to update your determination. Some states are trying to do this automatically. It's crucial that they have updated addresses and contacts, because that's how they're going to contact you for the most part, right? Through the mail. And so crucial for people to see those notices. And the way we make sure that happens is so they know, I'm going to get something in the mail from my state. I need to open that. I don't know about you, but we get so much mail that we don't know if it's important. Really understanding that your mail from the state is going to be incredibly important. We have a long special enrollment period so that if you're losing your coverage, you can enroll in healthcare.gov. We have put so many rules in terms of really trying to make it easy. And thanks to legislation that was really pushed by President Biden, we have increased subsidies in the Affordable Care Act marketplaces. So now people who are just above the Medicaid level in terms of income can often find a premium plan, a health plan on healthcare.gov for $10 or less. We have seen a record number. We hit Sweet 16 during this last open enrollment, and record numbers of Black and Brown people enrolled in Affordable Care Act coverage. And a lot of that is because of the increased affordability. So I'll just stop and could talk on, but I'll just say the most important thing that I want to make sure that people hear is how important it is for us to get the word out that people need to update their information to their states and how important coverage is, so that you're enrolled in healthcare before you get sick. Because if we want to move the needle on some of these healthcare issues, it's really about making sure people are getting preventive care, not just access to care, when you're at that moment of crisis. So I will stop there. I know we're going to save some time for questions, but thank you so much for having me. And thank you again for all the work you're doing.
Thank you, Madam Administrator. Once again, please give a virtual round of applause to Chiquita Brooks LaSure, who is leading CMS on our behalf and for this nation. We're going to mix it up a bit because we know we want to get to the action. What can you do? What can you do as an individual? What can you do as an organization to really address the fact that millions may be losing healthcare this week because of a thing called Medicaid unwinding? I'm going to call on my colleague, Patrice Willoughby, who is the Senior Vice President of Global Policy and Legislation. She leads the NAACP on the Hill and throughout the nation through the policy and ledge team. And so Patrice is going to actually walk us through what can we do to help our neighbors, our family members, our friends stay on the rolls and fight forward as it relates to keeping folks on the roads. Patrice, the floor is yours.
Thank you, Jamal, and thank you everyone for being here this evening. I have to say, this is full circle for me because I remember when Administrator Brooks LaSure was working on the ACA on Capitol Hill. I was on Capitol Hill working on the ACA with the Congressional Black Caucus, and here we are 10 years later, protecting the very legislation that we worked to pass, because make no doubt about it, this is an issue of equity. And the interests in this country that have lobbyists, that have money, they're always going to get a piece of the pie. But this is an issue involving numbers. And just as we advocated 10 years ago with the NAACP to get this bill passed, it's important that we advocate now to protect our care, to ensure that people retain their Medicaid. So, basic statistics, we already know that the Black poverty rate is twice as big as the white poverty rate. We already know that Medicaid, the Medicaid expansion, and it's a shame that you have to have a pandemic before we expanded it, but it was a time when we thought about healthcare in an equitable way. And the fact that enrollment surged as much as it did really reflects the fact that people need health care. So what can you do now? We need to get the word out. And we have toolkits that are available to you. And this is going to require some engagement in your community, but also with your legislators. For your legislators, reach out to governors and state Medicaid directors and stress the need to take this year and do ongoing outreach, staff up their call centers and their office staff to assist those that need it with enrollment. We know that while 38 states in the District of Columbia have adopted and implemented Medicaid expansion, there are a host of others that have not. And that means that we have to bring the message to all governors and state Medicaid directors to ensure they know that as constituents, you are watching what they're doing and you're going to ensure that they protect care and make it easy for people to re-enroll. The second thing that you need to do is get the word out to your friends, your family, your communities, your organizations. We have a toolkit that is online. Jamal is posting the link in the chat. It's critical for people who have been automatically enrolled. And this is, everybody knows that when people are under stress, they have less time to deal with a lot of the detail of their lives. So that means people can't afford to ignore mail that's coming from their state about Medicaid expansion. And those of us who are paying attention to this, we have to tell everyone in our lives to watch their mail, to open their mail, and to ensure that they are re-enrolled so that they receive their Medicaid. If people have moved, their mail may not get to them. This is just like voting rights. This is just like kicking people off of the voting rolls, right? So it's going to take affirmative and positive action to ensure that if people have moved, that they receive the message that they need to be checking with the state to ensure that they are eligible and that they're re-enrolled. So people can contact their state Medicaid agency, watch for letters in the mail, and also get free help to navigate this process. In the links that we are posting in the toolkit, there is a link that says getcoveredamerica.org, and that is assistance that will help people navigate the re-enrollment process in their community. And finally, if people are not eligible for Medicaid anymore, I mean, it's a good thing if somebody gets a higher paying job and they have more money and they no longer qualify. But there are many programs throughout the states that are offered through the exchanges and in the private marketplace through the state as well. And so people should really follow up to ensure that they receive health care from one of those mechanisms so that they remain covered. And for people who are re-enrolling in Medicaid, they don't have to wait for the open enrollment period. They should do it now, and action from the community should take place now to the end of the year, and making sure that those elected officials are doing everything they can to ensure they're helping their constituents remain enrolled in Medicaid, because healthcare is a human right.
So as you all can see, and I'm seeing some questions both in the chat and in the Q&A, Anissa, if you scroll up, this information is literally online live right now. So you can go, type in your information and send a note instantly to your governor saying, do whatever you can as my governor to ensure that people stay covered on the rolls by protecting our health care. The toolkit we just mentioned has a ton of information about what changes and what doesn't change in terms of the public health emergency ending. But our big focus is on those folks who could lose coverage. Look at the numbers. The projections can be as big as more than 2 million African Americans, nearly 5 million Latinos, almost 1 million Asian American and Pacific Islanders. And what troubles me the most are these statistics. The possibility of 13% of all Black children not having healthcare coverage come the end of this week is daunting. And so we are fighting forward now. So in this moment, we're going to take a few minutes to do and answer some questions. And I'm going to start with the questions that were typed in the Q&A. Please keep typing your questions in. And so I'm going to read this question, and I'm going to punt it to, we'll start with Madam Administrator for this question. And the question is, for Medicaid eligibility, how do individuals and families who are homeless or without stable shelter due to a range of circumstances actually get on the rolls? And we know that in some cases, folks work with the Salvation Army and other service agencies, but it's a challenge for families in crisis. How do these individuals actually get coverage given that their housing is unstable or unstable?
Such an important question. And there are states who are right now trying to grapple with rising numbers of homelessness. I'm really glad that you identified so many of the tools. And one of the best ways when you're referring individuals is to get help from an enrollment assister. So the tool that Patrice had up that has reaching an assister, because that person will know the rules within states about how to make sure you fill out your paperwork, which of course, a lot of our homeless population needs help with that type of, with filling out those types of forms that require to get coverage.
No, thank you for that answer. Another question I think is also directed at you, and I'll mix it up in a second, but is Medicare Advantage safe and good for us, or is private healthcare the way to go? I think that's a loaded question, but that's the question.
So I will say that as CMS administrator, I never endorse a particular mode. I would say that if you are enrolled in Medicare, you have, from CMS's perspective, access to traditional Medicare and Medicare Advantage, which should be following very similar rules in terms of coverage. And we've just put out a whole series of rules around what we call prior authorization. So what are the rules about making sure that your health plan is giving you access to the care you need? But in terms of thinking about coverage, you can get advice from all sorts of other individuals in terms of some of the pros and cons. But I would just really encourage you to know what your rights are under the Medicare program, that you have rights to particular access of medications, access to services that are provided by the Medicare program. And you want to make sure, as you are choosing a private plan, that you are, if that's the route that you want to go, that you're really evaluating to make sure that it's going to offer you the care that you need. I'm also going to make a plug for, there are a lot of other programs in addition to Medicare savings programs, which help with cost sharing. So consider enrolling it if you're a modest income or telling your folks about it. There are huge changes that are coming to the drug benefit that Siobhan mentioned, but you have to be enrolled in Part D of the Medicare program. And if anything that I'm saying isn't something you know, call 1-800-MEDICARE, 1-800-MEDICARE, or go to medicare.gov to get more information about what are the other programs you might be eligible for, things to know about your Medicare coverage.
Thank you for that answer. I'm going to turn to some state-specific questions. I actually got a text from one of our leaders in Virginia, Gayleen Connoyton, who lifted up that she has a federal navigator on her team, and they will be sharing out the work that they're doing around Medicaid unwinding. And so we know in a hyper-local context it matters, but let's turn our eyes to Brooklyn. There's a question raised that for access to care is not necessarily the issue. There seems to be another issue around having quality care that is culturally competent, that is connected to the holistic person from a cultural, race, and ethnic perspective. And so the question is, given all that we see in terms of the holistic approach to anatomical health, what else should we be doing and who else are we leaving out? And I'm going to open this question up to Dr. Proctor and Reverend Dr. Arline Bradley to also lean in answering what else are we leaving out beyond just access to care?
I would just open to say, I don't know necessarily leaving out, but we have to open up the floor to conversations around cultural competence, issues like bias in terms of quality care, provider bias. These are conversations, we talk about value-based care all the time. When you hear us say value-based care, that's really connected to the kind of care that our medical providers are actually being assessed by, right? Are they providing value to patients? This is an important space for us. I would also lean in on this kind of whole person. You'll hear us talk about things called the social determinants of health. It's buzzword public health language, but what it really means is that health is connected to everything that affects our lives, your education, your access to jobs, your access to economics, transportation. And so we need to lean in on some of these other areas because we understand that at the core of all of this, you can't be healthy if you don't have access to transportation to get to your medical provider. You can't be healthy if you don't have a job that allows you to pay your premiums or pay for those healthy foods that you need. So all those are connected. And as we lean in, and I see Representative Kelly has joined us, we're right on time with this conversation, because we also need to lean in on our advocates, right? How do we incorporate an advocacy strategy with our legislators? That's one piece that we're not talking about here, but that's got to be a part of our holistic strategy, that it's about the patient's health, but also about the community's engagement with those that are in leadership. But Dr. Proctor may want to weigh in as well.
Yeah, no, thank you, Reverend Arline Bradley. I will add that the best way for us to have culturally appropriate care is if we have people representing our culture providing care. So helping our young people know that there are careers and professions that are involved in medicine, healthcare, and public health, and that we can, and that there's room for us in all of those professions. Making certain that we have a clear pathway, the relationship between education and health, but education in health, and education in a way to see that if we are there, we will de facto have culturally appropriate care by making certain that there are plenty of folks who look like us who are involved in health and healthcare.
So we're going to do one more question before we are introduced to the amazing Representative Robin Kelly. And this question actually comes from the state of South Carolina. Sandra Land writes, what are some of the flexibilities that CMS has authorized for states? My home state, South Carolina, has not expanded Medicaid. And I'm curious as to what advice do you have for us in a state like South Carolina? How does the advice change for us? And I'll start with the administrator to answer this question.
So just to start with the second half of what to do with states that have not expanded, that is a better, of course, question to go to Dr. Pryor and so many of you who have gone state by state and convinced your states of the importance of expansion. But I will say, from my vantage point, what has worked well is continuing to drive just how incredibly important it is to the economy of the state. That has been, I think, one of the things that has really moved the needle. And it's been just a lot of hard work on the efforts of advocates across the country that have gotten states to expand. And I know so many of you are the reasons why that is the case. But what I would say is, for South Carolina, this process that we're talking about unwinding, it's still in effect for all of the people who are on Medicaid right now in your state. And what flexibilities we've given is we have encouraged states to space out how they do these redeterminations, these renewals. So rather than doing them all at once, which means that we're more likely and trying to do them quickly, we're encouraging states to take time so that they do it in, I'm blanking on the word, but basically do some per month so that we don't have millions of people getting notices and trying to turn them all around. That's one example, but our staff is working really closely with every state to help them to know these are the flexibilities we're giving you to try to make this process work as smoothly as we can.
Thank you, Administrator Brooks LaSure. And for anyone on the remaining questions, we will follow up and send out answers to those. And also remind everyone to go online and get the link to the toolkit and that you can have access to those tools that will help you speak to both public officials as well as people in your community. It's my pleasure now to introduce the Honorable Dr. Robin Kelly, who chairs the Congressional Black Caucus Health Brain Trust, and nearly 60 members, largest caucus ever, many representing not even minority majority districts, but a huge swath of the United States. The Congressional Black Caucus has been working on behalf of health equity since its inception. Dr. Kelly has chaired the CBC Health Brain Trust since the 114th Congress in 2015 through 2017. and she represents the 2nd District of Illinois, right outside of Chicago. So let's give her a warm welcome and welcome her to the mic.
Thank you so much, Patrice and Jamal, and thank you to the NAACP for hosting this event and calling attention to this pressing matter. I just have to say, I just finished speaking at a church on Saturday. It was my 2nd church in a couple of weeks, and we were talking about health literacy. We were talking about community health messengers. We were talking about how to advocate for yourself, that you're your best advocate when it comes to your health, and how we have to learn to speak up and not be afraid to speak up to doctors and ask questions and things like that. And there was a big push for more of us getting into the healthcare arena. Everybody doesn't have to be a doctor, but there's a lot of different ways that you can have a healthcare career. And I just want to acknowledge all the speakers tonight. I have worked with almost all of you, and I just want to thank you for your commitment to ensuring accessible and equitable healthcare for all. As was said, I'm the chair of the Congressional Black Caucus Health Brain Trust. I'm also the co-chair and co-founder of the Caucus on Black Women and Girls. And because I don't know how to say no, the co-chair of the Bipartisan Maternity Care Caucus. And I've been closely monitoring moving pieces surrounding the public health emergency ending and Medicaid redeterminations. As you know, at the beginning of COVID-19 pandemic, Congress passed legislation to provide additional financial resources to state and territory Medicaid programs and to protect access to health insurance for vulnerable low-income people. These continuous coverage protections essentially ensured that no one would be disenrolled from Medicaid during the public health emergency. As a result, more than 90 million low-income people are now enrolled in Medicaid and CHIP. Jamal, I heard you talk about the statistics of who can lose out in the coming months. These are staggering numbers of people who are at risk of losing access to vital healthcare services. Medicaid provides critical support, as you know, to low-income families, including children, pregnant women, and seniors. It is the backbone of our healthcare safety net, and we must do everything we can do. Congress must do everything it can do in its power to protect it. As a member of Congress, I'm committed to ensuring that all Americans have access to quality, affordable health care. We know that access to care is essential to achieving health equity, and Medicaid is a critical tool in our efforts to close the gap in health outcomes and address systemic health disparities. Unfortunately, millions are projected to lose Medicaid coverage despite being eligible due to procedural and administrative barriers. I was proud to join my Tri-Caucus colleagues in March of 2023, asking the administration to ensure that call centers have sufficient staffing so that families are not forced to wait for hours to provide information about their address or their eligibility. I am still working to ensure when families respond to state and territory requests for information, they are contacted in a language that they understand. Medicaid services must also use all available methods to update addresses so states and territory requests reach their intended recipients, including texting and emailing. We can also empower trusted community groups, managed care organizations, and essential community providers to help the greatest possible number of beneficiaries complete any paperwork needed to retain coverage. As co-chair of the Caucus on Black Women and Girls and the co-chair of the Bipartisan Minority Care Caucus, I am deeply concerned about the impact of the terminations on our most vulnerable populations. Black women and girls are disproportionately impacted by health disparities, and the loss of Medicaid coverage could have devastating consequences. We know that Black women are more likely to experience maternal mortality and morbidity, and Medicaid is a critical tool in our efforts to address these disparities. Over 40% of births are covered by Medicaid, and the loss of coverage could leave many women without access to prenatal care, childbirth services, and postpartum care, increasing their risk of complications and poor health outcomes. I hope that this event has been inspiring. I know it has, and informational, and is without question that the end of the public health emergency requires our leaders and policymakers to reimagine how we can make healthcare more equitable and affordable to help individuals and families maintain their coverage. Again, I want to thank all of you for your commitment to equity in our health system, for working with me and my staff, and just to let everyone know, my door is always open. We are focused on this, but we know that we don't have all the ideas. And Administrator Brooks LaSure, I just want to especially thank you for all the work you've done with us. And please know that my office stands with all of you in this fight. Thank you so much again.
Thank you, Representative Dr. Robin Kelly. Your words are really bringing us home tonight. Please, audience, folks that are at home, that are looking up the toolkit now and actually taking action now, really focusing in on your governors and your state ledge, please give a virtual round of applause to Representative Dr. Robin Kelly, Administrator Chiquita Brooks LaSure, President and CEO of NCNW, Siobhan Arline Bradley, the Right Reverend Dr. Arline Bradley, Dr. Dwayne Proctor, who serves as our National Health Committee Chair, Camille Troutman, who is leading the Youth and College Division on her campus in Georgia, our colleague Patrice Willoughby, my President and CEO, Mr. Derek Johnson, and a special shout out to the NAACP comms team and Anissa Rivera. The tools are on the website. We're going to fight forward like never before to expand Medicaid, to fight for Medicare solvency, to ensure that Medicare Advantage is stood up properly, and to do all of the work to ensure that not a single benefit is rolled back for the communities we love and serve. Again, if you have any questions, let us know. This is a coalition effort, and you're going to see the National Council of Black Health, or sororities like Delta Sigma Theta, all of the sororities and fraternities, my fraternity, President Johnson's fraternity, Sigma Gamma Rho, all of us together, AKA all of the churches and faith denominations. We're rolling up our sleeves to make sure that we send a message, hands off our healthcare, and to ensure that no one is left out of what this great country can offer. And that is in part the health and well-being that's the promise of America. So thank you all and have a blessed evening.